So, all this research about light and the circadian system has been known for a while now, right? These are not big breakthroughs. We're refining it. We're getting better data. How much do we need, for how long? We're doing great. There's great ongoing research on that. But because this has been known for a while, this has been tried in patients with dementia to increase light during the day and reduce light at night and kind of see what happens. And so they've done these cool experiments where they randomize care homes for people with dementia to different types of lighting. So workmen come in to all of the nursing homes and say, we're going to install new lighting, right? But then in half of them, they just like fool around. They don't really do anything. And then in half of them, they actually put in circadian lighting, which will get bright during the day, have that melanopic stimulation, and then kind of get dimmer at night. And then they don't, tell people which group they were in. And then they don't survey. These are pretty advanced dementia patients usually in these studies. So the patients themselves are not necessarily surveyed, but the caregivers are surveyed in the homes and they look at outcomes. And sometimes they measure activity patterns. That's one way that you can get at circadian rhythms, is looking at the rest activity rhythm using like a Fitbit, right? An accelerometer. And so they'll look at that and see what happens. And the results in general are positive for these studies. They do show benefits. Some of them, the structure is so strict in these homes that it's hard to appreciate the differences because the sleep-wake schedule is not driven by the patient, right? It's just driven by the caregivers and the environment. And so you can't necessarily see huge differences, but there are differences. Some of them show more differences, some of them show less. There was one study where they went really bright with the lights and there was more agitation. So definitely if it's way too bright and if it's the wrong color, you can, have some agitation. But mostly it's positive. There are positive effects on sleep and on rest activity rhythms and that. But the effects, unfortunately, are the effect sizes are smaller than we would like. So we have to keep doing more of these studies and really kind of refine our interventions. And then in Parkinson's disease as well, it turns out that this pathway, the intrinsically photosensitive retinal ganglion cells that talks to the suprachiasmatic nucleus, that pathway also releases dopamine in the brain. Dopamine is involved in circadian rhythms, in our sense of time, in alertness, in sleep. It's kind of part of that whole sleep-wake system. So the light actually stimulates dopamine in the brain. During my sleep fellowship, we would sometimes get the question, what's your favorite stimulant? Mine at first was caffeine, but then once I realized that light did this, I was like, light, right? Light is my favorite stimulant. And I remember when I took my sleep boards, I was like, oh, I need, something to wake me up. Let me go outside and get some bright light, right? Forget about the caffeine that's just going to make me pee during the test. Let's just do it with bright light. And so it's a stimulant, it releases dopamine in the brain. So in Parkinson's disease, where dopamine is deficient, these pathways are not working as well, you can actually get a boost of dopamine in the brain just with bright light therapy. So there have been a number of studies that have done this, where they give people bright light for half an hour, for 2 hours. The problem is they're very heterogeneous and the timing of the light administration is different in all these studies, but they pretty much all show beneficial effects of the bright light therapy. There was a meta-analysis that tried to aggregate all of the data. And the problem is, like I said, it's just so heterogeneous that it only kind of showed trend towards positive effect rather than a strong effect. But that makes sense given the quality of the data, the heterogeneity. So we just need to do more of these studies. I mean, nobody is making money from bright light therapy. Nobody's making money from sunlight. So the incentives are less strong. Plus, it's a little harder to regulate a drug. You take it at this time, the light, you have to sit here at this time, or you have to get outside. It's more logistically complicated to do those studies, so they're not being done, but they should be. And some of those studies have shown a reduction in Cinemet dosing with bright light therapy, and I've seen that clinically in patients that I've done this. So it's a great intervention. I can't make a recommendation about a specific protocol because, like I said, the research is very heterogeneous. I really like twice daily bright light therapy because I think there's some evidence that you want it have a long day, that compresses the dark period that will help consolidate sleep at night. So you do it in the morning, you do it in the evening, right? And then you have dark at night, and that can kind of be helpful. A lot of the Parkinson's patients will have dozing in the evening, dozing in the afternoon. So if you kind of like give that evening bright light, it can be helpful. So that's my favorite regimen that I recommend, ideally with a walk outdoors or sitting outdoors for an hour in the morning, an hour in, the afternoon is gonna be great. That's what I recommend. I will say with the bright light therapy, I do this a lot with people with Parkinson's, and I always want them to be like, wow, that bright light therapy was amazing. I feel amazing. Unfortunately, that's not actually what happens. Usually they feel pretty meh about it and they actually don't like doing it, which is kind of interesting. But nevertheless, the outcomes from a motor standpoint, the data is pretty reassuring that it is having an effect and their sleep will be better. That one I definitely see. If somebody's dozing in the evening, I do a little evening bright light therapy, the dozing stops, the sleep gets better. They'll come into me and say, oh, I'm having insomnia again. And I'll be like, are you doing the evening bright light therapy? And they'll say, oh, nope. I say, well, let's implement that again. The insomnia goes away, but they don't. It's not like taking, Adderall where you're like, wow, I feel great. Like it's a more subtle effect, but that doesn't mean it doesn't work. It does work. And, we should be recommending it.